And this is a cause that I'm going to continue to talk about until we have universal health care. So if somebody wants to shut me up, there's a really easy way to do it. Just get universal health care. I'll quit talking about it. We have a system right now which we know fails a huge number of people. It fails people in almost every demographic group except for the extremely wealthy. And we allow it to continue to exist. It is, in my view, an extraordinarily immoral system. Where patients, what should the priorities be? Patient has to be, and patient care has to be the top of the pyramid of things that are important to us. Right now, profit is up here, and the patients are someplace down here. And until we reverse that, we're not going to get the system that we want. And that frankly, I think that we deserve, and that Dan was right about this, as a symbol of our greatness. We like to think of ourselves as a great country. You hear politicians all the time say, we're the smartest, we're the hardest working. I think that's all hyperbole. Smartness and hard work, is pretty much distributed across the planet reasonably evenly. But I do think that we are great, and we're great for a reason that is not related to those things, but we're optimistic people. We think that anything is possible. I believe that anything is possible here, that we can accomplish the goal. Senator Obama says, who's at least the person with whom I've sparred on this issue, at least about a year ago anyway, has said that he has a mandate for children, but not for adults. But he thinks that you achieve universality by lowering the cost of health insurance. That most people don't buy insurance because of the cost of it, and I think there is some truth to that. You still have an underinsured issue, but people would buy insurance, most people, if they could afford to buy insurance. So you lower the cost and people will buy it. But there is a chicken and egg problem. It's a problem that Senator McCain doesn't have because he doesn't promise any of that. He doesn't. He's basically saying he's going to drop the cost of insurance by providing a truly bare bones kind of policy that will be available to everybody. But we're not buying a piece of paper. We actually want health care at the end of the road, and a bare bones policy that leaves out some of our treatments, as some policies do today, and this would be exacerbated. Doesn't provide a mandate or universality. He even goes further. Senator McCain says that the way most of us get our health insurance, 156 million of us get our health insurance through our employers, and he actually wants to take away the tax incentive for that, which, according to Health Affairs magazine, yesterday or today, came out yesterday or today, said that that should result fairly quickly in 20 million more of us being not having any employer-provided health insurance, and should raise almost immediately the uninsured rate, because some of us will go out and try to buy insurance on the private market, but it'll cost us $2,000 more than it did the other way.